We are going to demonstrate here NOELLE advanced birthing simulator with a body blue and also a pediatric resuscitator, infant resuscitator. So that we can see here is the NOELLE advanced version that we can perform birthing stations as well as the resuscitation stations. So this mannequins comes with pupils that we can three different type of pupil dilations: dilated pupil, normal pupil, and pinpoint on both eyes. And nasal tubings, we can insert nasal tubing and oral tubing. We can perform intubation on this mannequin. So I'm going to intubate the mannequin. So I intubate the mannequin so we can see the chest rise while doing the ambu bag, or we are ventilating. That we can get on the monitor. This is on a control device, OMNI code blue, that we can get on the ventilation. While we are giving the ventilation, if it's going to the lines, it will show the ventilation as well as the compression. When we are doing the compression rate will monitor on the display. Here we can do the settings for the compression. This is test mode. The coach mode, we can select the compression ventilation ratio. It's now 15:2. That we can change it to 30:2 or whatever the compression rate and ventilation rate we want. We can put it as accordingly. And the compression per minute, that we can adjust to 120 or 100 to 120. In between there we can adjust that. So those switches are provided here to select each modules. And there is pulse points on both carotid pulse we can palpate. That we have to attach a skews bulb. That skews bulbs are provided with the mannequins. So the skews bulbs we have to attach here and manually generate the pulse on carotid. Both carotid side we can get, and both brachial side we can get the pulse, and as well as the radial pulse. And IV arm, both hand has the IV arms. We can administer IV fluid, and we can administer injections, and we can perform the phlebotomy training, blood drawing. And both the deltoid muscles has IM sites, that we can insert the injection or the sterile water to practice IM injection on both deltoid muscles. And this is a birthing station. While we are coming to the birthing station, it's a birthing baby here, a fetus here, and it attached to the placenta that are attaching inside the mannequin. And we can get the fetal heart sound, a speaker attached to the fetal abdominal wall that you can see here, so that we can get the fetal heart sound while over the umbilical region. Here we are controlling that birthing stations. The fetal heart sound is showing here is 140 beats per minute. So while we are oscillating, we can get 140 beats per minute, the fetal heart sound. And the speed here, 1 minute, I put it at 1 minute. So that's for a delivery timing. So according to the delivery timing, we can change the speed. If it's a 1 minute, within 1 minute the baby will deliver to the vagina. And we can increase that speed. We can increase 2 minutes, 3 minutes, 4 minutes, 5 minutes. Like that we can increase, and you can give the OK, then the baby will deliver according that time. So I am putting it in 1 minute, so I will show you that how the baby is delivering. So it's now 1 minute now. I am giving OK. And also option here for dystocia. First I will show the normal delivery, then I will go for the dystocia. We can turn off the dystocia and turn on the dystocia on clicking on this button. Now dystocia is off. For the demonstration purpose, I am detaching this abdominal wall from the area, because you can see how it's coming out. Now baby is coming slowly. This is in a normal position. We can keep it in a breech position, transverse position. And also the baby will rotate while during the delivery time. Now you can see that baby is rotating. So automatically rotate left and right. We have to use the lubricants while we doing these birthing stations, where we have to use the lubricants over the baby head and also the vaginal region. So up to the baby's elbow, it will come out. So then we have to manually pull out the baby from there, and then we have to remove the placenta by manually. Then we can do the clamping and then detach from the umbilical region here, or from the placenta we can remove the umbilical cord. From here we can remove, or from here we can detach. Here we can see a bag inside. So this is for inflate. From here we are attaching a squeeze bulb here, and when you are giving the inflate, this will inflate inside, and we can keep a desired position of the baby's head through the vagina. Or when we are doing the Leopold maneuver or palpation procedure, we can get in a desired position. So for palpation, there is provided a bed. This we have to keep it inside the abdominal region. This bed is we are keeping inside like this, and this bag is coming with an squeeze bulb that we can inflate. So the baby's position, whichever position we are keeping it, if it's in ROA, LOA, or transverse, or breech, whatever position we are keeping, and then we have to keep it this cover over the fetus we are keeping here. And the cover we have to place, and then we can do the palpation. Then we can do the Leopold maneuver. So we can get the baby's head. Now it's in the normal position. So we can get the palpate baby's head over this lower abdominal region. Both legs are coming with intramuscular access on the thigh, both thigh. This part we can give intramuscular injections and intramuscular injection training. And this one we can attach through here, this screw here that we can detach and attach the leg, then screw it back. And both leg we can, it's an articulating leg, so you can keep it in a birthing positions also. And this vulva is fully dilated vulva is coming, two of the coming, one is attached, one extra is coming with the Manikin. And also the postpartum training modules are coming with it. This is a postpartum uterus that we can attach to the vulva. It's an extra vulva coming for the postpartum hemorrhage, so that we can practice postpartum hemorrhage, minimal, moderate and excessive bleeding we can simulate through this. And also is coming with 3 episiotomy suturing that we can attach here. Episiotomy repair, that one is midline and one is right and one is left, one is coming with it. And this baby coming with this advanced NOELLE, this baby for the afterbirth resuscitation sections. We can do umbilical catheterization, CPR, intubation, and also bag mask ventilation. Umbilical catheterization, umbilical pulse is present while we are giving the squeeze bulb. Manually we have to generate umbilical pulse. The internal structure is anatomically right, that we can see the rib cages and lungs, stomach, and also the liver present. The baby's pupils are normally dilated, normal pupils, and we can do the nasal tubing, nasal suction. I'll just demonstrate how to intubate. So I just intubate the baby. You can see the chest rise while we giving the we can get the chest rise lateral and bilateral. If it's going into the right position, in the right, if it's in the bronchial junction, right in the place, so you'll get the lateral, both lines we'll get. If it's going to left side or right side, it will get only the bilateral, one side chest rise. And also we can do the nasal tubing, as I already mentioned, nasal tubing, ear irrigation, eye irrigation. Both ear we can do the ear irrigation. And these tubings are provided here. While we are doing the nasal tubing or oral tubing, that contents will drain out through this tube. And also for the umbilical catheterization or umbilical blood drawing, we have to attach the blood bag to this tube, so we can withdraw the blood through this. One artery and 2 vein sites are here. And it's fully articulating baby. The joints are articulated. And also we can perform compression, chest compression, 2-finger method or thumb encircling method. So the rib cage is there, that's why we can palpate the sternal notch, the lower half of the sternum we can identify and give the right compression. And the accessories are coming with it, lubricants, syringes, blood powder, and also blood stand that we can, the simulated blood we can introduce to the baby and as well as the mother. Also, the fetus baby, the newborn baby, birthing after the birthing session, we can do the oral suction and also the nasal suction. The holes are provided for the nasal. Both the nasal cavity has the holes that we can do the nasal suction as well as the oral suction. So it's working with an adapter that we have to attach to the power plug. So this attaching to the Manikin. While we are attaching this, it will start while we turn it on. This code blue OMNI code will turn on, and according to the scenarios, whatever the sections we are doing, if we are in a resuscitation section, we can go for that resuscitation section like compression and ventilation. And if you are doing the birthing station, we can go on this, that we can do the fetal heart sound, we can increase it, we can decrease it, and also the speed, we can increase the birthing speed, we can increase and decrease. And also we can do the dystocia, turn off and turn on. If the dystocia is turned on up to baby's shoulder, it will come out through the vagina, and then we have to do the vacuum suction, vacuum delivery. We can perform the vacuum delivery. On this fetal baby, you can see the suture points, fronternals, and also while one spot is here, we can remove this cap to attach for the breech delivery. This, while we are opening this, we can see this hole here. That part we are attaching for the breech deliveries. Now we will start. If you start the baby, means start the Manikin, then it will push out the baby in this position. So that's about the NOELLE, advanced NOELLE birthing simulator with the resuscitation and the newborn resuscitation.